We want to give the unvaccinated staff extra time to collect their dose. But I want to be clear, we will apply the mandatory vaccination for healthcare workers.
Quebec postponing the deadline for healthcare workers to be fully vaccinated by 30 days, originally supposed to be on Friday, October 15th, now November 15th. On that day, unvaccinated healthcare workers will be suspended without pay. The health minister saying it took long, late-night discussions to come to this compromise after saying the government wouldn't budge on the deadline. Now he says they've analyzed the consequences.
When we had the potential departure of the unvaccinated staff already, we find ourselves adding undue pressure on our network, and especially on the vaccinated health workers who have been at the front for months. And if we continue like this, we will run into a wall.
By Friday, 25,000 healthcare workers would have been absent from the job, 14,000 of which are partially vaccinated.
It certainly would have been an enormous strain on the system, okay? Because you can't lose 10,000, you can't lose 15,000, and you can't lose 20,000 healthcare professionals in the emergency room, because mostly are nurses, healthcare workers. You can't lose without affecting the population tremendously. So I think it is a wise decision.
The health minister saying he doesn't want a repeat of the first wave when long-term care homes saw the most infections and deaths.
We're low on personnel right now, so we cannot take that risk. So that's the reason we're going to ask them to do the same thing. Go with a clear mandate to test their employees, their non-vaccinated employees, starting Monday, to make sure that we provide a safe environment.
Unvaccinated public health sector employees will be tested 3 times a week. Financial incentives like COVID premiums and recently announced bonuses for nurses moving to full-time positions are revoked for the unvaccinated.
The College of Physicians already a few weeks ago came out with a suspension of licenses to practice, and that really moved physicians to get vaccinated because they couldn't go into telemedicine, they couldn't go into anything else. So now the other large orders have very recently come out with that. So can we give those individuals a chance, now that they see that their orders are following suit, to now get vaccinated?
If we give them today this olive branch, it's because we realize that over the next few weeks, they really can make a difference.
Dube says he hopes 7,000 healthcare workers can be vaccinated from here to November 15th, but some are skeptical.
Maybe the numbers are going to dwindle down a bit, but I think you're still going to have a fair number of healthcare workers who are not going to be vaccinated, and therefore there's going to be difficult choices.
I have a last message for healthcare workers who are not vaccinated yet. We are reaching out to you, and we sincerely hope that you will take this offer.
In Montreal, Alyssia Rubertucci, City News.